So let's start with the facial rejuvenation, and you can stop me anytime you want. All of these procedures are done here in this office. We use twilight anesthesia where you're asleep. You don't feel anything, you don't remember anything, but you're breathing on your own. It's done by a CRNA who's been with me for 25 years. She's put my wife to sleep. She put my father to sleep. I trust her totally.
Did they wake up?
Yes, they did. Glad you brought that up. Woke up successfully. Good point, though. So let's look at, and when you talk about face, and a lot of things we're going to talk about, it breaks down into skin, muscle, and bone, and fat. In the face, we don't do a whole lot of bone and work. We may do some chin implants and some cheek implants. So mostly it's skin, muscle, and fat. If the problem in your neck is only fat, then liposuction is the right thing to do. Use a little 1/4-inch incision in that crease under your chin, suction this area of fat, and you literally vacuum the fat off, almost like you were whittling a stick to look the way you want it to look. So you're whittling that fat out till you get it to the way you want it to look. You put a couple stitches in there that are out in 7 days. You wear a chin support for the first 7 days, and then when you're sleeping, and you can see a nice improvement. So there she is before, here she is after. You notice that little pucker right there, or that pouch, that's her jowl, is still there because that jowl is not fat. It's muscle that is sagged. So suctioning fat out isn't going to improve a sagged muscle, and so it isn't better. But you can see this, what we call cervical mental angle, is much sharper here than it is here. We didn't do anything to her skin. So the next step up in the ladder is, okay, if you've got too much fat and you've got loose muscles, liposuction isn't going to fix the loose muscles. So a myeloplasty will do that. And a myeloplasty is where we make the same incision in the crease under the chin, but you make it about 1 inch long, and you'll lift the skin and fat up off of the muscle. You'll take the fat off under the muscle where you can't get with a liposuction. It's just not safe to go under the muscle where vital structures like your carotid artery and jugular vein and your larynx live. That's not safe. So we visually take that fat away. We then take the fat away on top of the muscle as well. We sew the muscle like a tight trampoline and close that incision, and the recovery is very similar. And we'll show you some results. Here's a guy who is clearly overweight and would have been a better candidate if he'd lose some weight, but he couldn't do it. So here he is afterwards, and you see his neckline is better than it is here, and he looks a little more youthful, he looks a little more healthy or athletic, but you know, the best candidates get the best results. He wasn't the best candidate, but he got a reasonable result. Here's a little bit better candidate. And you see hardly any curvature there. That's her curvature after surgery. Can't see her incision. A nice improvement. Here's somebody with a little better candidate, a little less fat in her neck, but she's still got that angle. It's not sharp. Here's a sharper angle, incision in her chin, hard to see. I'm going to keep asking you to look for these incisions because people worry about in facial surgery, well, you know, they're going to have scars on my face. How could that possibly look good? There are only a few pictures that you'll see, and all these pictures are taken at 6 weeks. So do you look good 2 days after surgery? Not too much. So you got to wait and give it time to heal like everything else. So here she is, congenitally born with that neck, not fat. There she is after taking the fat out and tightening the muscle. Okay? So the next step up in facial rejuvenation, if you've got too much fat, you got loose muscles, and now you got loose skin as well, but it's in your neck area, maybe not your face. So we do a neck lift. And neck lifts look like this. So here you see that same jowl, and you see that neck area here, and this predominantly pertains to people over 50. I found doing myeloplasties over 50, they've lost enough elasticity in their skin that it doesn't contract well enough. And I've now done 3 myeloplasties in people over 50 and had to go back and convert them into neck lifts. And most of those I talked into doing the myeloplasties because I thought their skin was good enough and it would contract and be good. I was wrong. So that's the last myeloplasty I'm doing on somebody over 50. So we make an incision that starts here, hugs the ear, on the back side of the ear and down. You can see with the way she's wearing her hair, it's difficult to see. And women have an advantage there over men because men don't have the hair. And she's got that same incision under her chin, but you can see her jowl's gone. That neckline is much better, and that's what we're trying to achieve. Here's another one. 6 weeks out, before, after, her incision is hidden right in there and up into here. Not too bad. Look at the confidence she's got here versus here. Look at her neck from the front. Same thing. This is the before, this is the after. Tried to fix that, but I can't find the original slide, so I can't reverse it. But you can see, difficult to see her incision, nice improvement. Again, same thing. And you can see a little skin irregularity. That reminds me to point out that things aren't perfect, but they're going to be safe and reliably and predictably better after surgery. And that's a good example. She's very pleased with that. I notice that because I'm a perfectionist. Same thing here. Look at the jowl, look at the neck. Much better. I'm not sure what that is. Looks like a little rash to me. That's not related to her surgery. Okay, so now the further step. So every facelift gets a neck lift. It's part of it. But a facelift also gets the cheek area, and it's intended to tighten this fold right here. That's the nasolabial fold. Also gets the jowl, also gets the neck. So these are the incisions. They don't go way up there. They usually stop about there. We undermine all of this tissue. We find that muscle and we tighten it. So it's a two-layer repair. It's muscle tightening, put back to where you were when you were 25 years old, and then tighten the skin around it, tailored it in and contoured for that particular patient. And so a schematic, you can see going from there to there. So let's look at some real people. All we're looking at is the fold, the jowl, and the neck. So, and the other thing we got is computer simulation, because a lot of people come in. I would come in and go, well, this is interesting, but what am I really going to look like afterwards? I was speaking to a gentleman from LA, and the biggest problem people come in with is, I want to look better, but I don't want to look weird. I don't want to look, there's so many people on TV and the movies that look different, bad different. We don't have a technique like that. I think that comes from fat grafting and taking too much fat, adding too much fat in the wrong places, and there are a lot of examples of that. We don't have any problem with people looking different. They look different because they look 5 years younger or 10 years younger, but they look like them. They don't look like different people. And this computer simulation, or we call it morphing, shows you what you can look like. And so there's our simulation. Look at her jawline, her neck. There's her neck and jawline afterwards. And you can see her incision right there is a little red. Still got some swelling, and this area has more skin there because she didn't do a brow lift. Should have done a brow lift, didn't want to do a brow lift. But early on, this is tighter than this is because this is still loose. And it works itself out, but it takes about 8 to 12 weeks. So if you need a brow lift, I'll show you, I don't think it's on this talk actually, but when you do one part of the face and all of the face is aging, you can get out of balance. And that's an important thing to remember. But the computer simulation in here, I think, was very accurate. Here's a lady. This is our only deaf patient that we did. Got a wonderful result from her facelift. And she did a great technique because that neckline doesn't go with that hairdo. So she updated her hairdo at the same time she got her new face. And it was fairly effective because people also, they don't want everybody to know. I mean, they want to look better. But sometimes they're so much better, they don't really want to discuss that with people. So if you change your hair, people go, wow, you look so different. Did you get your hair done? Yes. It just wasn't the only thing. And so it's a helpful technique. Again, men can't do that very well. So folds, jowl, neck, natural result, still a little red at 6 weeks. Here she is from the front. Did her eyes, did the facelift. You can all see just it goes together. Another lady from the side. You're still looking at this area, this area. Here's her incisions, smoother, more youthful. Looks normal, doesn't it? There she is from the front. Eyelids and face. Neck, incisions hard to see. And it reshapes the face. It gives it a more oval face because as we get older, things tend to come down and in and square off right here. And so it reshapes that, it makes that more oval, takes away the laxity of the skin. This is a quantity procedure. We're going to talk later about quality procedures, which are more chemical peels and lasers. And frequently, patients need both. and we'll help you with that. Eyelids, face, she just looks normal, natural, better. Facelifts last forever. Okay, nobody's challenged me on that. And what I mean by that is you're going to reset the clock. So you're going to set it back, some patients 10, 15 years, some patients 5 years, but the clock's still ticking. And so after the surgery, you try to slow the clock down by not smoking, wearing sunscreen, having good nutrition with a lot of protein in it. Fitness probably plays a role. That slows the clock down, but it doesn't. The surgery doesn't stop the clock. It just resets it. So this person, for instance, is going to look better at 75 than she would have at 75 if she'd never had a facelift. Doesn't mean at 75, say 20 years from now, that she couldn't use another facelift because she will have had aging. She will just have looked better than she would have looked. Does that make sense?
Yeah.
Okay. I think you get the picture. Look at the tremendous neck she had and the eyes, and just looks better. Look at this gal. Look at the oval shape, the tautness of her eyes and cheeks. If I can get it to change. You know, look at that. Looks like somebody's mom. Looks like somebody's date. Look at all this stuff. And there she is after. And you can see some sort of imperfections there. But you know, the better candidate gets the best result. That girl before you, really good candidate. That girl, lady, needed it bad, but isn't as good a candidate because there's so much aging. You know, the younger lady, the earlier lady, she starts on third base. It's easier to hit a home run if you start on first base than if you start at home plate. You got to go all the way around. And then the durability of the result. If you start with good tissues, it lasts longer than if you start with not good tissues. They're older. So you hear people talking about, well, it works better if you start younger. To some extent, that's true. Just like if you build a house with straw, it doesn't hold up as well as if you build it with stone. All those biblical references, they just keep staying true all through many topics. They all look normal, don't they? Finally got a guy picture, and look how swollen his eyes are here before, and they're still swollen afterwards. But you can see this stuff's gone, and the tone and shape of his face is better. There he is from the side, and you know, there are his incisions right there. No hair to hide them. Now, that's all surgical treatment. There is a non-surgical treatment that we've had for exactly 1 year called Ultherapy. And Ultherapy uses crossed ultrasound beams to create heat underneath the skin in the connective tissue. And the connective tissue is that gristle around a steak that you get. And when that gets burned, it creates fibrosis. Fibrosis is scar tissue that tightens up by cicatrix. And it's a nice way to improve the tightening of the skin. It can be used on the brows. It can be used on the cheeks and neck. There is no there is anesthesia, but you don't have to go to sleep to do it. I inject the face to numb it up. There is no incision. There is no downtime. And it gradually, over about 6 months, tightens the skin up. It will conceal fat. It won't take it away. It'll conceal loose muscles. It won't take it away. Surgery is the gold standard. But Ultherapy is really nice for people who want an improvement, but they're really too good to have surgery. It's really nice for people who've had facelifts and want to prolong their results. It's okay for people who need facelifts, but don't have the time, don't have the courage, don't have the resources, something. It's not their best option, but it may be their best option. So I'll show you a couple of those pictures. And here are the advantages and for anesthesia and surgery and all that kind of stuff we just talked about. And this we just talked about. So you can see her neck and how that's better. It's not as good as it would have been with a neck lift, but it's better, and there's no surgery and no downtime. Jawline better. That's not much better, maybe a little better. Better here than there. Not as good as a facelift. So it's a tool. It's not right for everybody, but it's a nice option. Yes, ma'am?
How long will that treatment last?
Well, that's a good question. We've only had it for a year. It's been around maybe 5 years. it's not going to be as durable as a facelift or a neck lift because you're not doing as much. 10 years from now, will you be able to tell you had it at all? I don't know, but I wouldn't bet on it. I don't think it's your first option. You know, it's really great for us, and I don't have these pictures in here, is you get somebody who's got early signs of aging, and it'll erase those. Or you got somebody who's really young and has maybe too much fat, and they don't want to do liposuction. You can tighten the skin up enough to conceal it. You know, for people who really need facelifts, I don't think it's the best choice.
Would you recommend it for anybody over 60?
Well, depends on the 60. There are 60-year-olds and then there are 60-year-olds. If you're chronologically 60 but physiologically 40, it might be great.
But not the typical, say, 60.
Not the typical. I mean, surgery's still the gold standard. And so we present your options and give you our best opinion. And the other thing we do about it, because we don't know how good you're going to be either. Where there's a neck lift, I know how good you're going to be because you can't be any better. But I don't know that with the Ultherapy. So what I say is, if you want to be as good as you can be, Ultherapy is unlikely to be your choice at 60. If you want to be 20 or 30% better, it's still a viable option. If you do it and it doesn't get you where you want to go, we'll give you half of the cost of that back toward doing the correct surgery. We don't want you mad at us. We want to help you get to the place you want to get, and I think that seems reasonable. Yes?
What about the décolletage, the lines from sleeping on your side?
Yep. We have something called Rejuvenation, which I like better for that. The Ultherapy people want us to use their machine to do that, but they can't show me a picture where it's a lot better. And these laser companies, this is not a laser company, but this type of company, they'll show you all kinds of pictures, some of which are not really fair pictures. The lighting's wrong. They haven't even showed me a picture of that, so I can't recommend it.
Does that tighten skin, or it just...
It's supposed to tighten skin, but unless they show me a picture where it's worked, I'm not going to recommend it.
No, the pen.
The Rejuvenation, yes. Yeah, the Rejuvenation can be used on face, and it makes thousands of little 1 millimeter puncture wounds in the skin. Its concept is very much like Ultherapy's, except Ultherapy's is 3 to 4.5 millimeters under the skin, so there's no evidence on the skin at all. Ultherapy makes that 1 millimeter, and 1 millimeter is, you know, 1/10 of a centimeter. It's 1/30th of an inch. Little tiny holes. If you were making a tattoo, you would have ink on the end of that 1 millimeter. But you do thousands of those little holes, and then it induces the collagen and fibrosis and elastic fibers in the skin, and that tightens it. And I can show you good results with that.